Ma'am, next slide, please. Our Center for Healthcare Management. Ma'am, can you please change the slide? Yeah, thank you. Our Center for Healthcare Management was started in 1998. And in 1998, we ran a course of Master in Hospital Administration. This was in association with Johns Hopkins University, USA and Hinduja Foundation. From 2095, we run this program of postgraduate diploma in hospital management. It is a AICTE approved 2-year full-time program. AICTE stands for All India Council for Technical Education. There is one more, I would say, milestone. Ma'am, of the before slide, there is one more milestone about our institute. In 2022, we renamed our Center for Healthcare Management as Dr. Kakarla Subbarao Center for Healthcare Management. Some of you might be knowing about Dr. Kakarla Subbarao, sir. He is a world-renowned radiologist. He is also the first director for Nizam's Institute of Medical Sciences, NIMS. In his will, he had donated certain grant to our organization. So seeing the good work done in consultancy, training, and research by our organization. So in his honor, we renamed our center as Center for Dr. Kakarla Subbarao Center for Healthcare Management. And currently our center is headed by Professor Dr. Subodh Kandamuthan, sir. Now coming to the session outline, my session would be covering these 3 questions primarily, like what is management, why a career in management, and where will be career prospects in hospital and healthcare management. Coming to the first question, what is management? Management, ma'am, next slide. Management, I would say, is not a new subject. It is a very practical oriented subject, and every one of us manage our professional and personal lives. It has been into existence since the start of human civilization. Now, as future dentists, you would be managers of your dental clinic or dental hospitals. As dental students, you are managing your patients. Ma'am, next slide. Yeah, as dental students, you're managing your dental patients. Like just take a case of steps in fabrication of complete denture. These are the 9 steps involved. Please excuse me if there are certain errors in these steps. So though it is shown as simple 9 steps, there is a lot of coordination involved in managing this single case of complete denture fabrication. Like there is a lot of coordination involved in the presence of patient, behind the patient, with the staff of the dental technicians, with the department, with the department laboratory. There are a lot of coordination involved. So if one has to sum up what is management, I would say it is managing the resources. And to sum up even more precisely, it is managing of 5 M's. Ma'am, next slide, please. Yeah, it is managing the 5 M's, that is man or woman, materials, machines, minute, and money. See, whenever when I'm treating a case, a patient is involved, staff would be involved. If it is a private dental clinic, you would be having some technician or maybe a receptionist involved for coordination of patients. Then any dental procedure would have a lot of materials, consumables involved. And the machine, the equipment required, the dental chair, the X-ray machine, all of this would be the machines involved. The appointment scheduling, that if it is a multi-specialty clinic, coordinating with the other specialists, all of this would be your time management, and capital is required. The money is involved at each step of it. Whenever there is a lot of material involved, obviously money is also involved. So to tell what is management is managing these 5 resources. And these are the 5 M's of management. And any industry under healthcare is focused towards providing quality care to the customer or the patient. So utilizing these 5 resources, these 5 M's, such that you provide quality service and at the same time bringing profits to the organization. Like whichever is the organization, any healthcare organization would strive for profits because profits are essential for the growth of organization and for sustainability of the organization. So to sum up what is management, it is managing the 5 M's to provide quality service with patient at the center and at the same time bringing profits to the organization. Now this looks very simple, this sounds very simple, but just imagine maybe a clinic which was started recently with a low patient footfall. The management is simple. When the volume of patients increase, the resources with the similar kind of availability of resources, it becomes the management becomes little involved. When it comes to management of a polyclinic or a multi-specialty dental clinic, it becomes even more involved. So now imagine, next slide, please. Now imagine the working of a big organization like a dental teaching hospital. So that involves lot of staff, lot of materials, lot of equipments. There are a lot of bulk sellings, bulk buyings, how to manage all the staff, all the levels of staff. It becomes a very complex phenomena. So in such cases, a formal qualification or a formal training would help to better effectively manage the organization. So I would say management is managing the 5 M's, and it is complex. Ma'am, next slide, please. Now coming to the next question. This was what I was speaking about, the management of a teaching dental hospital. Ma'am, next slide, please. Yeah. Why does one require to pursue a career in healthcare management? Obviously, the first question, the first point which comes to anyone's mind is healthcare as a recession-less industry. Like we had seen during the time of pandemic, everything was shut down, but it was management that was the healthcare which was booming. So healthcare, I would say it is a recession-less industry. It is a very secure industry. And then when it comes to the supply and demand, this is one of the publications, and it shows that the supply and demand has a huge gap. If you see, the supply is around 3,400 and the demand is around 11,000. So the demand is 3 times more. And these are the statistics in the year 2017, that was before the pandemic. This demand has obviously increased more after the pandemic because of the increased awareness and also the resource crunch we had seen during COVID management, like how the resources were not managed well in multiple areas. So that was due to the lack of healthcare managers. And one more important aspect is with the penetration of insurance in healthcare industry, certification has become important. For example, in the case of hospitals, there is something called as NABH. NABH stands for National Accreditation Board of Hospitals and Healthcare Providers. For a hospital to be certified by NABH, NABH says that it has to follow certain protocols, certain standards have to be followed. For following such standards, for implementation of those standards, for training the staff of such standards, there is a requirement of trained staff. So even for this accreditation also, there is a requirement for hospital managers. And apart from that, just for your information, NABH has also given standards for dental healthcare providers also. This was released in December 2021. Next slide, ma'am. Now, this slide also, like you can just see the underlinings. These are the extracts from the report given by Planning Commission of India. It says that for the implementation of public health programs, when I say public health programs, like the government programs which are run to reach to the public, like you have TB control program, leprosy control program, AIDS control program, vector-borne diseases. In Telangana state, you have Arogya Lakshmi, you have multiple anemia programs, IFA programs. So for implementation of these public health programs also, there is a lacuna for healthcare managers. So this is what the report tries to tell. Coming to the next slide. Yeah. Now, why do dentists or why do clinicians have a good career prospect in management? Like, I would say hospital is a very specialized industry. The knowledge, the technical knowledge required for running a hospital is very complex. There are various medical terminologies used, medical jargons used, the processes are complex. So for a clinician, they invest their 5 years in their education. So they know they know the working of the hospital. They have the working knowledge of the hospital. So that becomes an asset when they're managing a setup like a healthcare setup in a healthcare industry. Then coming to patient communication. Like if we had seen the steps of complete denture, similarly, all through the course of 5 years in BDS, you are constantly interacting with the patients. Like from third year, you would be interacting with the patients. So you exactly know what the patient requirement is. And for healthcare industry, patient is the consumer. So you understand what is that patient is requiring and what is that the patient is looking for and what should be done from the management point of view to make that process smooth. And apart from that, it gives an accelerated career growth. With a good understanding of management, it helps easier, or I would say you can manage your dental clinic effectively and efficiently. Maybe you can think of once you start managing your one branch of clinic, you can think of expanding it to another branch. And coming to leadership roles, if you are working in a multi-level organization, having an understanding of management, systematic levels of managing the organization, it becomes easier to climb the ladder of leadership. And for the ones who want to explore the other domains in healthcare industry, as I said, management is a very practical oriented discipline. So these concepts would be the same around various domains of healthcare industry. So for the ones who want to explore other domains under healthcare industry, other than doing it clinically only in dentistry, this management knowledge is definitely useful. Now, moving ahead, this was about the second question, why dentist and why a career in management. Coming to the last question, that is where? Where are the career prospects? Ma'am, come in. Please move on to the next slide. Yeah. Where are the career prospects in hospital and healthcare management? So these are roughly the different domains where a management graduate becomes eligible for a career. Like first one would be hospitals. When I say hospitals, it involves all the kinds of hospitals. Not-for-profit hospitals like the trust-based hospitals, government hospitals, private hospitals, corporate hospitals, single and multi-specialty hospitals, any kind of hospitals, it would require managers. And as you know, the clinicians are already busy. As you see the disease burden in our country, the clinicians are already busy delivering care to the patient. So we have a requirement for healthcare managers who would be delivering care in indirect patient care, who would be delivering indirect patient care. Apart from this, you also have multiple capitalists or multiple investors who come up into this hospital industry. So you have a lot of corporate chains also. For example, Apollo, Care Group of Hospitals, Medicover Group of Hospitals. They have multiple branches spread all over the country. And then coming to public health and NGO, as I spoke previously, for the implementation of public health programs also, there is a requirement of clinicians with an expertise in managerial skills. So this qualification makes them eligible for various positions of program managers for various national health programs, state health programs. Apart from that, even for the health NGOs, you have various health NGOs which are assisting the government in providing care to the end user. And apart from that, there are something called consultancy services. Like there would be certain clinicians who would be starting a setup. They do not know, like for example, and apart from that, as I said, there are many investors who are looking in for opportunities to invest in hospital industry. So when they start up hospital industry, they are not the domain experts. They exactly do not know what is the requirement for hospitals. So hospital consultancy is one area where they take the services of the consultants, hospital management consultants or healthcare consultants or the quality consultants about starting up a setup in hospital. So this is one large area where there are a lot of career avenues. Apart from that, you also have insurance. Most of you must be knowing about insurance. Like there are different processes in insurance where there is a requirement for relationship with the hospital, insurance company, and TPA. There is a lot of coordination involved between these three kinds of organizations. And most of the times, many times, it happens that the claims get rejected because of lacuna in the documentation. So what is the kind of documentation the organization, the insurance organization is looking for? That would be clearly understood by a person who has clinical expertise as well as the clinical expertise. And how do you manage all those things are already taught in management. So all of this would help to get a good career options in insurance. Then you have various diagnostic chains like you have this PH Vidya Diagnostic Center, Gaulikar Metropolis. There are multiple diagnostic chains who also have various branches distributed all over the city. And for these branches to be run, you require branch managers. So that requires, again, a clinical expertise as well as the managerial skills. Then the medical equipment, like medical equipment, which are precisely very technology oriented, which require a lot of clinical expertise. Even these medical equipment organizations look for people who are qualified in who have the clinical expertise and the managerial skills. And then the last one is the healthcare IT. Healthcare IT is one area which a lot of young generation is attracted. It is a little technical field. That's the reason the next slide I have completely focused on healthcare IT. Ma'am, can you change the slide? Yeah. Like nowadays, we speak of digitization of health records. Like, for example, if you see a case sheet of a patient, you have the chief complaint, history of present illness, past medical history, any other family history. You have multiple areas. Like what these, like now, all of these is digitized. So you have an interface where you have all these subheads. But a technical expert, a person who develops these kind of softwares will not be aware of what are things which are required in these softwares, in these clinical areas. So domain expertise is taken by the clinicians. So these people with the clinical expertise and the managerial expertise, they act as a bridge between the healthcare IT companies and the various hospitals. So that is how, like these are the different areas. Like for the lab, you have lab information system, the requirements of a lab, the radiology, inpatient, outpatient, all these multiple areas is different. So healthcare IT, apart from this, nowadays it is the period of apps. You have a lot of applications coming up. For building of those apps also, there is a requirement for a knowledge of clinical expertise. So all these inputs are taken from the domain experts and then used to prepare in the development of the app. So that is about healthcare IT. So these are the various areas which open the career prospects after management in hospital and healthcare management. Ma'am, next slide. These are just brief cutouts from the newspaper about various vacancies in different areas like public health, corporate hospitals, diagnostic chains, etc. Ma'am, next slide. So I would just end my presentation saying that blending clinical expertise with managerial skills helps to shape the healthcare's future. Seeing a big picture, it gives you an opportunity to innovate with health systems such that healthcare becomes affordable. It also gives an opportunity to become a policymaker such that you can impact much bigger fraction of society. Now, I would request Reshma ma'am to continue with with her presentation. And for any questions, we would take up after Reshma ma'am's presentation.
Thank you, ma'am. So a very good evening to one and all. Am I audible?
Yes, ma'am, you're audible.
Thank you so much. Okay, so let me take a brief moment and just introduce myself. So I'm Dr. Reshma M. Gopal. I'm an assistant professor in the Department of Healthcare in ASCI. And like Priya madam, I am also a dentist, and post my dentistry, then I went forward with masters in hospital administration. And I'm glad to say that I took this critical decision at that time, because at that time we didn't know what is the scope of taking up management. But believe me, I never had to look back in my career. My career spans of around 5 to 6 years, in which I have, tried very versatile fields. So I went in from hospital operations to insurance department, claim settlement and everything, and then to academics, research, etc. So if you aim at, having a career which is very fast tracked and you achieve your dreams at a very quicker pace, I would definitely say that management is your go-to option. So let me take you forward with the presentation. As of today, I have been entrusted with the big responsibility of sensitizing you related to a course that is being conducted in our college. So this is a long-term program. It is called as a postgraduate diploma in management, hospital management, which is PGDHM. And our center, as ma'am told you already, is called as Dr. Kakarla Subbarao Center for Healthcare Management. So as you can see this picture, this is our campus in Karitabad. It's also called as Bella Vista campus. It is one of the palaces of Nizam, which has been converted now as an academic institute. So let me take you forward with the program in a brief. So how does hospital management in ASCII look like? Okay. So we focus on the overall development of a candidate who joins us. So hence we focus on both academic and non-academic aspects. So if you talk about academic, we start with the current chairman in the advisory board, Dr. Raghuram sir, who is a world-renowned onco-surgeon. He is one of the members who is a deciding committee when it comes to curriculum. So all of you must be thinking, why PGDHM, madam? How is it different from MBA, and what are the advantages and disadvantages? So the advantage is that by a PGDHM, we are able to autonomize and we are able to frame your curriculum according to the industry needs every year. So there is a modification that happens according to your skill sets. And every year the curriculum is framed according to the demand of the industry. And sir, like Raghuram sir, he helps us in deciding the new curriculum based on the industry demands. We have certain workshops and certifications that happen while you are with us in the institution. There are eminent internal and external faculty who have an industry connect, who come here and teach you towards this subject. There is an exposure to live projects. So while going through the session forward, I will show you some glimpses in the form of pictures of certain projects that have been undertaken in the recent past. So there are the kind of learning that happens here is not monotonous and one way. It is a two-way approach. So we encourage you also to interact. So it's like role plays and, management exercises and debates and everything. So building up a good personality as such, that happens in the organization. Now, our industry experts who come are two types. One, the person who is a CEO level, who is coming with an industry connect of different subjects. And second is a very important factor, are important alumni. That is the people who have studied here and now established themselves as CEOs, MDs, and doing really well in their field. So we encourage them also to come and interact with our students on a regular basis. Now, this is done so that they can sensitize their peers, their followers who are coming back with them to learn what are the key skills required to sustain in the industry. Now, there is an important factor in this 2-year-long program. We have an internship which runs for 3 months. So this internship comes in between 2 semesters. That is the first semester, second semester. Post the second semester, there is this internship that happens. Now, in that internship, the basic thing is that you get a practical exposure. So we attach you to a hospital or to an organization of your choice, and there you get to learn how practically the operations happen. So the curriculum is designed in a way that we meet the theory and the practical experience together. There are multiple conferences that happen, and we encourage our students to go in there, do paper presentations, interact with the other industry members. In the non-academic activities, we have a lot of campaigns that are being conducted, cultural activities. So I am sure that in student life, that is one thing that you would look forward to all the time. The fun activities that happen to engage yourself. So inter-college fests and, farewell, freshers, all these. And all the festivals we celebrate here together in the campus. we have a strong alumni connect. And let me tell you this, that, it's a pleasant surprise that every time when we have a placement drive happening in the campus, most of the time it is our alumni who come to recruit our students. And that gives us a lot of honor and, satisfaction that we have sent in so many good alumni who come back and given back to the peers. Yes, so then we have a unique feature that ASCII has been associated with a lot of government and non-government sector leaders. So we have a frequent interaction with the leaders who come in, who have a word with our students. As I told you, when we go forward, you can see the glimpses of that soon too. So that forms the USP of this program. Okay, this might look quite chaotic, but yes, this is the syllabus of what happens of in the 4 semesters. I will not go very deep into what happens, but in general, the first semester focuses on giving you a strong foundation of letting you know where you are and what are the important aspects of hospital management. The second semester is the longest, which has all the core subjects, and because it is a semester that leads you to the internship, that is your first entry to the industry and to learn practically. So it is focused on giving you a lot of subject theoretical knowledge, second semester. And going to the third semester, we have core subjects along with something called as a dual specialization. So like Priya ma'am explained in her session, that there are different domains into which you can go post this hospital management program. So these domains you can specialize into. So for example, healthcare IT, hospital accreditations, health systems, public health. So these are certain areas where you can specialize in. So you will have a mentor dedicated to, focus your attention into that. Our campus placements usually happen at the end of these third semesters. Our drives happen, and the entire fourth semester you are being attached or placed to the organization, and you then prepare a project there and come back to us with the presentation, the Viva Voce. So that's about the entire syllabus of the program. Now, you would wonder that, okay, how do I get into this organization? What is the eligibility? How do I apply? So basically, the graduates having 50% overall, and I would say that our mix of students has around 60 to 70% dentists, and their success rate is very high, believe me, because they have this sound clinical knowledge along with when they establish themselves with the management skills. They are well preferred in the industry and more sought after. So you need to be, a graduate, and being a BDS is an added advantage. Then any valid score of an exam like XAT, MAT scores are taken. The course, as I told you, is a 2-year-long program with 4 semesters, and the curriculum is designed according to the industry's demands. Post the internship, that the internship happens after the second semester, which already I told you, and the placements in the third semester. The fees for the program is 6 lakh, and it's for 2 years. And we have a 5% of rebate for the defense personal wards. There is an assistance provided in case you require a bank loan. Now, our campus is a lush green facility. You can see, lovely peacocks around all the way, and mess and lodging is available. We have an excellent placement track record for all batches. You can see our website details provided below, where you can go and check in all our extra details as well. So you would like to know probably that, what is the campus placement partners that we have with us. So let me take you through that quickly. So the domains, like Priya ma'am mentioned already, I would just reiterate that it is the hospital sector, the public health, the healthcare IT, health insurance, healthcare consultancies, and startups. So it depends on your skill sets and your, want where you wish to go. We usually provide you placements there, but these are the broad sectors where you get hired frequently. And towards your left, you can see the companies that have been associated with us for a long time. So let me tell you some hospitals: Medicover, AIG, Continental, KIMS. Okay, I am sure all of you, if you belong from here and across India, these hospitals have their branches, and they take you into operations, quality, marketing, HR, according to your skill sets. Then we have companies like Napier Healthcare, which is based in Singapore, Deloitte, I'm sure all of you know. So these are the companies that take up students for healthcare IT. And we have consultancies and startups, entrepreneurial startups like TrueCare, Nano Health, who take up students for their planning projects and all, hospital planning, consultancy kind of projects. So these are the broad areas where you get hired, and for a very, very good package as a fresher. So let me take you through the photo gallery of ASCII PGDHL. So this will contain all the pictures of what I had mentioned in the academic and non-academic USPs. So the first one is definitely the hospital visits. So we believe that the student needs to learn by looking and observing things. So we take our students to different hospitals like trust-based and government hospitals, public sector, and even private corporate hospitals to let them know the kind of operations that happen. So these are the pictures of our recent batch visiting different hospitals. You can see Ramdev Rao Hospital, which is a trust-based hospital, as well as Apollo DRDO Hospital. So all these hospitals, they have frequent visits to learn what actually happens practically. This picture, as I told you, that we have frequent visit from leaders. So this is Shri Dharmendra Pradhanji in the photo, who is the Minister of Education, Minister of Skill Development and Entrepreneurship in Government of India, who visited us and in our campus, and he met our students. So that's the picture. Now you can see above picture is of Dr. Sangeeta Reddy ma'am, who's the Joint MD Apollo Hospitals. She interacted with our students and gave insights. Below is Dr. P.V. Ramesh sir. He is a former Chief Secretary interacting with our students. I'm sure all of you know Vice President, former Vice President Sri Venkaiah Naidu sir. He also interacted with our students. In the fun-based activities, we have freshers. On the right side, you can see, this is Batukama celebrations. Towards my right is Dr. Sangeeta Reddy ma'am. Now, she is a great educationist and also Ritu Verma ma'am's, actress Ritu Verma ma'am's mother. She visits us frequently and gives a lot of inputs on how to go about. Now, these are some of the field visits that happened. UNICEF ASCII on IFA dot implementation. And you can see our students as part of a walkathon for health awareness campaign. Yeah, so around this time last year, we had conducted a dental event on our campus. This was for dental graduates all around. And we had eminent panelists discussing what is a way forward after dentistry and what can be the different career options available. And this is the media coverage that happened for that as well. This is the batch 15 students convocation picture. Now, as Priya ma'am had already told you, we have a lot of projects ongoing. So this is one of the UNICEF ASCII projects that happened recently. It's Anemia Mukt Karimnagar. You can see our students as well in the picture who had come along with us for the field study. This is Shri GS Naveen Kumar sir, IAS. He is a former Special Secretary Health Government of Andhra Pradesh. He came to interact with our students. Yes. So that sums up my presentation. Thank you for your patient listening. We are waiting to hear from you, and please feel free to ask us any questions that are there in your mind. Thank you so much.
You can even type your questions in the chat box. And one more thing, there's a feedback form which would be shared, feedback form link which would be shared in the chat. Request all of you to fill up that. I think the link is shared. You can fill up the form and at the same time post your questions as well. Yeah, we have one question which says it's from Tushar Maheshwari ma'am. Like work experience is important for the same. Ma'am, this course is open for all freshers as well. There is no requirement for a work experience to pursue postgraduate diploma in hospital management. There is one more question, like which course is better, MBA in healthcare and hospital management or postgraduate diploma in hospital management? MBA in hospital healthcare and hospital management is a master's degree, and to give a master's degree, it requires an affiliation by the university. And when it gets the affiliation by the university, it becomes difficult to change the syllabus regularly as per the industry requirements. So that's the reason we chose to be postgraduate diploma in hospital management, so that as there are changes in the industry, as per the requirements of the industry, we change our syllabus as well. To just quote an example, like we had COVID during the pandemic, we had a subject introduced like hospital operations during COVID. So that gives us that flexibility. So that's the reason we chose to be postgraduate diploma in hospital management. And there is other question from anonymous person. Can you explain about the job opportunities and the salary packages for a fresher? Reshma ma'am, would you like to take that question?
Yeah, sure. So this job opportunities, like we already told you, if you want to know the designations, I can say that operations management in hospital, or manager in hospital, quality manager in hospital, or HR in hospital, or that is in hospitals. In IT, you get designations like business analyst, and insurance, you get it as a claim specialist, medical officer in charge for claims, insurance consultant for hospitals, and so on and so forth. In public health, you get it as a public health specialist or a medical officer concerned for a project, etc. So these are the some of kind of designations that you get depending upon the field that you have chosen. But apart from that, the salary packages definitely differs. For hospitals, for a fresher, you can expect anywhere from 4 lakhs to 6 lakhs per annum. And in IT sectors, it is a little higher. It goes from around 5-6 to average. Even the previous highest package was around 9 lakhs for one of our previous batch students. So it depends definitely upon the skill sets, and yes, definitely that. Yes, any other questions?
Request you to get your doubts cleared, whatever questions you have on your mind. Also request you to fill the feedback form. Ma'am, there is one more question which says, is there any difference between healthcare management and hospital management? So about this question on difference between healthcare management and hospital management, like though we name this course as postgraduate diploma in hospital management would be the fulcrum, and it opens up the domains for the various industries under healthcare. as you have seen the placement partners, our campus placement partners, we cater to all the industries under healthcare. Like we have hospitals, public health, healthcare IT, insurance, depending upon the interest area of the student. So I hope that answers your question. Though it is named as postgraduate diploma in hospital management, it opens career options in various industries of healthcare. And there is one more question from Pravalika. Would like to get a little more insight on the work nature of healthcare IT professionals. Ma'am, would you add on that? Reshma ma'am, I'm audible? Am I audible? Am I audible? Okay. So there was one question about healthcare IT positions. So healthcare IT, like as I spoke about digitization of the medical records, like once you want to digitize all the medical records, or maybe you want to have electronic medical records, you require various clinical expertise. Like for example, if you take laboratory information system, what is that, what details are taken from the patient, what is the details, how do the reports are generated, what information is required, all of this would be understood by a person with clinical expertise. So this clinical expertise is utilized by the companies, by the healthcare IT companies, to develop those interfaces. So the person who is qualified in the person who is having the clinical expertise as well as the managerial skill expertise, they are chosen such that they act as the bridge between the hospitals as well as the healthcare IT companies. As hospital, my requirement would be like I would be requiring these fields, maybe some specific requirements I would be having. But when I, as a hospital, when I convey it to the healthcare IT professional, it may not be easily understandable by the healthcare IT professional. So to have a clear-cut understanding, this person, the expert, the domain expert, as well as a person qualified in management, would be the person who would be understanding the requirements of the client, that is the hospital, and conveying it to the technical team of the hospital IT. I mean, sorry, healthcare IT. And there was a question about joining in internship. You have to finish your internship to be eligible for the course.
Ma'am, am I audible?
Yes, ma'am, you're audible now.
Okay. Hi, ma'am. Was the question on the difference between healthcare management and hospital management being taken up?
Yes, yeah, I have told. You can
Okay.
just repeat that, not a problem.
Okay, so basically the like all of you are clinical specialists, you are BDS. So I would say that there is a very meager gap between healthcare management and hospital management. But as a clinician, the course that you choose should be hospital management rather than healthcare, because healthcare management is a more generic one, wherein even the other graduates can take up businesses, and any healthcare organization can be headed by them, operations can be done by them. But hospital management specifically specifically gives us an opportunity for clinical people to take up charge as, medical superintendents or CEOs in hospitals and do operations in hospitals, etc. So it's always a better choice than the healthcare management. And especially with the courses where you get, in hospital management itself, you get different domains to study and explore. It will be a better option than healthcare management, especially you being clinical. And there was one more question regarding internships that's been addressed, ma'am.
Yes, ma'am.
Okay.
I said you have to finish your internship to be eligible for the course.
Yes. Yeah, they have asked one more question, ma'am. Can we get the recorded session of the webinar?
Any other questions? I request all of you to fill in the feedback form. It will also help us to understand your perspective. Any other questions?
So I think there is one more question by Tushar Maheshwari. Ma'am, can we also join any institution for teaching the same that we have learned? So I understand by this question that you are asking about the academics, right? So if in that case, definitely you can join into academics, but always it is better that before joining, like as a fresher, you go into the hospital sector, you take the experience of the industry, and then you come into academics. So maybe probably 2 to 3 years later, you can come into academics, because the field knowledge is very important to be put into teaching. So that is one suggestion. Ma'am, you want to add anything to that, Priya ma'am?
No, that's the same.
Alekia, no dear, it is not an online course, it is an offline course.
I hope all of you have filled the feedback form.
There are a lot of benefits of having an offline course. Why is because you develop that kind of an interpersonal skill. If you are aiming to work in this industry, communication is something which is very important, and that you have to do most of the time face to face. And if you are opting for an online mode, there is a chance of a miscommunication, or you do not have the as much as you learn in a class. Probably you would not learn in online, is my opinion on this.
So if there are no more questions, can we close the session? Can we end the session? We hope the session was useful. Looking forward to your feedback forms as well to understand. And there are more questions. Shall we end it?
Sure. Thank you so much, all of you.